It's your girl Ariza, licensed clinical social worker, test prep guru, your personal, hype squad. Yes, whatever you need me to be to help you level up and pass that exam. And I'm just excited. Yes, you already know I always say I got a banger for you. But before I get in that banger, check your girl out. Yeah. Got the merch. Yes. We a whole vibe over here. So I got to make sure that I show up and show out. So I'm here to give you the content and the confidence so you can get licensed. So anyways, let me go ahead and jump into this video. Today I'm talking about something a little different. I haven't seen too many videos on this topic, or maybe there is, maybe they're not. Because honestly, to be truthful, I don't go look for other videos. I just hear people say, oh, I watched that video on this and I watched that video on this. And I'm like, oh, wow, cool. I did a video on that. So I normally do my own research, figure out what the people in my community need, what people in my course are saying they're having struggles with, or whatever it is. Then I find a video to make it a little bit more entertaining. I call it edutainment because it's educating, but it's entertaining at the same time. Yes, if you do a course, you're kind of like listening to something. You're very structured. You don't really have all the excitement or the funny jokes and all the other hoorah stuff that comes with when you're on YouTube and you can watch a video and get a little bit of laughter. You know, it makes learning fun. Doesn't make it feel all stuffy. So that is what I'm doing. And this video right here is a little special one for me. It's a little shorter than the normal ones. We'll see. Sometimes I get carried away and it gets a little bit longer. But hopefully I can keep it in a little nice time frame because it is something that doesn't take a lot to go over, but it's going to be enough for you just to see it, know it, and understand it. So without further ado, let me go ahead and break it down and just tell you what we're doing today. Today we're going to be talking about assessment tools. Yes. Assessment tools. So you guys might have, kind of got that, might have not known what I'm talking about. But if you're struggling with like screening tool questions on the ASWB exam, I'm going to help you master the top 5 tools that you will likely see, can't guarantee it, but you're likely to see it, and I try to stick with the no fluff, just giving you all the essential points. So yes, your girl's going to share screen. This is going out to my YouTube channel members. They're going to actually get a copy of this because what I decided is that those folks that are investing into the YouTube channel, why not get the content that comes with the channel? You see, you feel me? So for instance, they're paying a subscription, very low cost subscription every month. They get the videos first and they get cheat sheets. So now every video that I do an exclusive cheat sheet just to give you all the nuggets and all the main points so you can print it off and have it hand by hand. And instead of doing your own notes, your own note card, you can just use that sheet and just kind of write on it. Yeah, so I got a nice little Google Drive just for members only. Make sure you don't be spreading around to other people who are not members because I can see who's sharing and all that kind of stuff. Your girl did her due diligence on that. So yes, you'll be able to get the content and get the information that I'm using. I just started that, so I know some of you are gonna see this video 6 months from now and say, hey, where's the drive with the If you join, you'll get it. I don't think it's something I'm gonna stop, but I know a lot of times people ask me for things that I started 6-7 months ago, or maybe that was the special or the magnet or the device that I was using to kind of let people know I exist and all that stuff, and then I no longer use it. So with that being said, I'm gonna keep it really simple. If you're part of the community, the free community, where you sign up, do the 3 questions and all that good stuff, there's some cheat sheets up there, but I'm probably just not going to add any more cheat sheets in there in that community. I'm going to just be devoting it to my YouTube fam. Those that are members of this channel, they're going to have an exclusive vault with all the YouTube cheats. All right, without further ado, let me go ahead and jump into this discussion. So let me share my screen. All right, here we go. So you guys know how to zoom in and all that kind of stuff. So right now the video today is all about content. All right, so you're going to be really good with knowing this information, understanding it, so you can actually apply it when you're taking the exam and know what to use. So I did this a little different. We're going to start out with 5, then we're going to break it all the way down to 1. So the 5th tool that I'm going to go over, it's kind of the first tool, but it's number 5 here. You get it. I know it's confusing, but just go with it. All right, we're going to talk about the cage, and the cage aid. So this is a quick screen tool used for individuals that have alcohol or drug use problems. That is the purpose that we use this tool. So normally the tool will have things on there like if you have 2 or more yeses, there's a potential problem, and it's like a yes or no screen. It doesn't really give you a severity score, but it lets people know when there's an actual problem or an issue or something that needs to be addressed, and is like, hey, we need to do this. So that is pretty much what that is, and I want to kind of make sure you understand it. But I want to take it a little step further because some people are like, okay, I know cage, but what is it? And I think if you understand what the words or the mnemonic, the acronym that is used, you'll be able to better understand it. So I'm going to do that. CAGE stands for cut down, annoyed, guilty, and eye opener. Yes, they're pretty much terms used to differentiate or to understand where the client is in their journey. So cut down might have a question like, have you ever felt like you should cut down on your drinking or drug use? Annoyed would be, have people shared they were annoyed or criticized your usage? Guilty would be, have you ever felt bad or guilty for using? And then the eye opener is like, just think about it. Do you wake up in the morning and feel like you have the need to use drugs or substances? And do you feel like you need it to steady your nerves and those kind of things? So it's kind of an eye opener to see that it is a problem. And that's pretty much what CAGE stands for. And then you have the CAGE aid. The aid just stands for adapted to include drugs. That's simple, guys. I know it sounds crazy, but that's what it is. CAGE and then CAGE adapted. Adapted is include drugs. So basically that framework covers a broad usage of substance use. So it makes it a little bit different when you're actually, how can I say this? When you're assessing someone that's using alcohol versus someone that's using drugs. So that is the helpful hint for you guys to understand when you see CAGE on the exam and it's asking a question like, what should you do next? Or what type of tool should you use first? Or anything like that? Or what is the best tool? Or what is the most effective? We don't know if it's an FNBM question, but we know what to do and how to answer it because we're going to know this term. All right? You got me? I know you do. All right, guys, real quick. I'm always talking about the community, the LCSW vibes. We leveling up. And this is the sneak peek of the community. As you can see, it's on and popping. We got a lot happening. I got ethics over here, human development, or study guides that you guys asked me about on the YouTube channels. All right there. Test questions. You just want to level up and learn and see if you can answer those questions. I'm testing your knowledge. Let me go back to the home screen. If you want to learn more about what services I offer and what other things are there, that is where you go to the learning tabs. We leveling up, so why don't you join so you can level up too. All right, let's talk about the next one. The next one is audit. Audit is pretty popular. People are able to remember what audit is because they simply know that the A stands for what? What would you say? I can't really hear you through the video. What are you saying? Yes, correct. A stands for alcohol. So basically audit stands for alcohol use disorders identification test. Yes, so this is basically a tool that is used to assess someone's alcohol usage. It identifies the level of risk related to the use of alcohol. Like, is it harmful? Are you dependent on the substance? Is it hazardous? Like, it gives you these different tools to understand how you would need to proceed or interact with the client that has these specific issues. So when you think about this, think of severity. Like, understand how bad the person's drinking is. That is what you're using the audit for. So in that case, you would use audit over CAGE. So a score of 8 or more on this specific assessment tool requires some type of intervention. Let me pause real quick for that. So I'm giving you these tools and you're listening to me and you're like, oh my God, I seen them on the exam. I seen them on a practice question. I didn't know what they meant. So remember, these type of questions are more so along the lines of a recall. You're going to see the question and it's going to ask you like what tool or what assessment measures should you use and all this type of stuff. You just need to understand what it is and what is it used for. All the context and the type of questions that are asked on it, that's a bit much and it's a little bit too much probably for you to kind of process and digest when you're just trying to have an understanding of it for the exam. So try to look at this using it simply to just have a better understanding of which type of tool that you would use when you're working with a client that's dealing with alcohol, dealing with drug use, those type of things, dealing with depression, dealing with anxiety, dealing with all the different stuff you want to kind of look at and have those assessment tools. So that is pretty much where we're going with these assessment tools as a whole. GAD-7, pretty simple, guys. What does GAD stand for? Yay! You got it. You're hella smart. You know exactly what it was. Generalized anxiety disorder. Yes, and it just lets you know that there's a 7 question or 7 items with it comes to this assessment tool. So this basically screens for measures of severity of someone that has generalized anxiety disorder. The key is like that excessive worry over 2 weeks. We want to watch for physical symptoms, restlessness, fatigue, all that good stuff. This captures that. So you want to really hone in and understand when you're using the GAD tool, what's going on, what's happening with the client, and have a better understanding, because this is really, really important to measure their level of anxiety to determine how we need to proceed and how we need to move forward. All right, let's move on to the is this the 4th tool? Well, actually it's the 4th one that I'm going over, but because I'm listed it a little differently, it's the 2nd tool. So we did the top 5 starting from 5 on down. So number 2 is the PHQ. PHQ. So the PHQ screens for the level of depression, how depressed an individual is. And it's really important to understand these tools because of course we know we're in a day and an age where a lot of clients deal with anxiety and depression. So this is one of those tools that are used to kind of measure where a client is in the level of depression. And I will say it's super important. They actually have 2 magic questions, like anhedonia. You've heard me talk about this before. That's like losing interest or pleasure in things, and depressed mood. Those are things that you really want to assess, because when someone's dealing with significant anhedonia or feelings of depression, it can lead to something more severe. So it does ask you questions about suicidal thoughts. It lets you know if we need to do a full safety assessment. And that leads us to the next one. We're not going to jump into it. I'm going to stick with the PHQ-9 for a moment. But that kind of lets us know that if they are having these severe symptoms, how we might need to move and do something different, because it's pretty serious and pretty severe. All right. So keep in mind, the PHQ-9 is one of the most common tools for screening, diagnosing, and monitoring the severity of depression. It has 9 items that correspond directly with the 9 diagnostic criteria in the DSM-5. So that's kind of how they do it. So just focus on it, because if the client is meeting all those criteria, then you're easy to see that, okay, they clearly have depression, and major depression or severe or moderate or whatever. You can actually define where they are based on this assessment tool. Hey guys, let's stop by to tell you this. You do not have to win alone. Absolutely not. People in the community are winning each and every day. The proof is in the pudding. Go in the community. It's free. We're throwing down test questions, case studies, the FNBM method, all the details and everything you need so you can succeed. Click the link in the bio and join. You don't need to do this alone. See you soon. Last but not least is the CSSRS. That is the Columbia Suicide Severity Rating Scale. This pretty much is the gold standard for assessing suicide risk. It is systematically evaluating the suicidal ideation and the behavior. It helps clinicians, therapists alike, whoever does work directly with clients, really determine the severity of the risk and the level of intervention that is required. So that's what I was saying before. If you do the PHQ-9 and the client does that assessment and you see the scores are like ding, 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 they're really high and they're like, press, oh my God, this is serious, it's severe, they're having suicide ideation. Then you might need to do the next level assessment, the Columbia scale, because you really want to see how serious this is. Is the person at risk of harming themselves or, committing suicide, or how intense are their thoughts? What are they planning? Like, it helps lead into all those things. Really, really important, guys, to have these tools. So of course, if you are a member of the community, well, the member of the YouTube community, a member of the page, however you want to say it, you will actually be able to get this. So let me do this for you real quick while I'm on this video. I should have did this before, but I'm gonna go ahead and type it in here real quick. YouTube.com/ for those of you that are following along on your phones at LCSWVIBES. And then we're going to do a / join. That is literally, that's why I probably should have did it on another page and not here, because it's not going right. But actually, if you go there, for those of you on the YouTube channel, all you have to do is do the at LCSWVibes, which I know my computer's acting all janky because I have all the stuff for the Vibes channel there, and you / join. That is actually going to give you the channel that you need, the actual website you need to go to actually join the channel, so you can get all the cheat sheets and all the guides and everything you need. I'm also going live on there, so I can give you some tools, some tips, some guidance on your test prep journey, assisting you and however you see fit, so you can pass this test and level up, level up, level up, level up, level up. Yes, that is the plan. That is the goal. So I hope you found this video to be helpful. I hope I was able to give you some tools and some strategies and things that you can utilize just to make this a little bit simple and bring it fully home. So those of you that made it to the end of the video, just remember, when you see CAGE or audit, you're dealing with substance use, typically alcohol and some drug related stuff if it has the CAGE aid. So when you see aid on the end, think of that D as drug. That's how you have to do it. We have to find a way to do this in our mind. So likely to see CAGE and you're dealing with alcohol. Likely to see audit, you're also dealing with alcohol. One scale's a little bit more severe than others. So think severity. The audit is really over the CAGE when it comes to intervention level and the seriousness of someone using drugs. So the CAGE is a quick screen, where the audit really helps you identify the severity of how significant this disorder may be. The substance use disorder may be. And then you have the GAD-7. Just remember to see the GAD. That's going to let you know it's for anxiety. And then the PHQ-9. Not really an easy way to do it, but just think of 9 as the criteria that you have to meet for depression, So we want to just kind of be able to use this, understand it, have a better idea of why someone would use the PHQ-9 versus the GAD. Aha! I knew it was good that I recap. PHQ-9, we did not talk what it stands for. It stands for Patient Health Questionnaire. Patient Health Questionnaire is what PHQ-9 stands for. So that might help you also. If you're doing a patient health questionnaire, you're trying to assess how they're doing overall, and normally we can just tie that into depression, I guess. I don't know a simple way to get you to understand that one. I just threw that out there. But yes, that's the only one that doesn't have a correspondence pretty much with the depression. So if you got a way that you remember the PHQ-9 and just easy, and you want to hit it in the chat section or the comment section and let everybody know, because people read the comments. You know I read the comments. I comment on each and every one of y'all videos. Actually, I did a video and somebody picked up something that I said that was incorrect and I've used a step out of order. I pulled that video real quick. It was about almost 200 of you guys that watched the video. I said, pulled it, had my editor fix it real quick, and we're uploading it so that way you can see it, because I don't want to confuse you guys. This test is so important. So many of you guys are getting close. I have people who are winning in the community. I haven't even listed it yet, but I had literally 8 people in the community pass between yesterday was Monday, so I don't know when this video is going to post, so don't worry about the dates. I don't want to confuse you. Are you studying for the LCSW or LMSW exam? Don't waste time on the wrong prep. Try my test prep program for free with a full module that gives you the real strategies, the real practice, and real results. Plus, you get access to my exclusive test prep community where you'll find support, study material, and accountability. No risk, no stress, just results. Click the link in the bio so you can get ready to win with the winning team. But pretty much the day I had 8 people on a Monday pass, put it that way. 8 people on a Monday pass. Some had passed on that Saturday, on that Friday, that Saturday, and then maybe on that Monday. But pretty much it was a lot. And that was 8 people who notified me, not including within the community, not including people who notified me on TikTok or YouTube and said, hey, I passed the exam as well. So we're getting into like double digits of people passing on a daily basis in the community. Yes, a few times a week. So our numbers are really high, guys. You got to look at that. I know sometimes you look at these test prep and they're like, we've had 100 people pass this month. 100 people, and they got like 10,000 people in the program. But check us out. We're smaller now, but we're mighty. And we won't be small for long, because you guys are killing it. You're joining, you're showing up, you're purchasing the boot camp, the courses, and all that kind of stuff. I'm building a team. I got some LMSW coaches that are joining me. They're all part of the One and Done team. I actually personally coach them and supervise them. And some of them I'm still supervising now and coaching and mentoring. So they have a little taste and a little flavor of the LCSW Vibe tribe with them. And they're going to be helping you get what you need to get to pass this exam. And I got to give a shout out. All these people are passing, but like I always say, everything. There's a few you have taken this test recently, you have not passed. But I will tell you this, which is crazy to me. People who have worked with me, if it's direct coaching, community, the course or something, and they did not pass their test at the boot camp or something, I'm telling you, these folks are missing it by the skin of their teeth. Like, I'm talking 5 points and under, guys. Yes, 5 points and under. That's all it is. I just realized my hand was hella ashy, so that's why I put it back down. But anyway, so I'm realizing that these people are passing or getting so close, like closer than they've ever been. And sometimes it's not that you know the information. It's not that you're not ready. It's not that you're not prepared. Sometimes it's second guessing. I have so many people that I know their nerves are through the roof, and I can do everything in my power to try to help calm you, but I can't walk in that test site with you. I can't. So you have to start affirming yourself. You have to start feeling like you got this. You know it's for you. This is what you were built for this. You were meant for this. This is your blessing. This is your calling. You gotta truly believe that, guys. And if you believe it, it will happen. It will come to fruition. I'm telling you. Let me know in the comment section what you need more of. If you need us to come up, I got some people. I got a personal motivator for me. Like, my husband's my biggest fan. When I tell you he went out, got me the merch and all this kind of stuff, he's connecting with some of you guys, reaching back out, because I've been swamped. Your girl's been hella busy. And I've had to develop some team, and who better to have you by your side than the people that truly believe in you and your vision. So I'm blessed in that sense. So when I feel down, unmotivated, feel like something's not working, I have somebody in my corner cheering me on. And you guys need that too. And if you don't have it, that's why you need to join the community, because I'm going to be that cheerleader and that one that cheers for you. I got you. If you didn't pass that test and you reached out to me, you can put in the comment section if you want to be vulnerable and transparent and let people know that I stuck with you. I still continue to meet with you. Even though your private tutoring sessions have ran out, I'm still giving you access to the boot camp. I'm still letting you join the community. You're with me, or should I say, I'm with you until you pass. That is the big difference. I'm here for my people all day, every day. This is not just something I'm doing. This is something that I truly mean, that truly warms my heart. It's my calling. It's what I've been designed to do. I've been doing this test prep stuff for well over a decade. Most people think I'm new and I just started this. I have another YouTube channel because I have a private practice, and I kind of share some business tips and strategies over there. And on that channel, I get a little bit more personal, show you my concerts, behind the scenes, things I do, work out and all that kind of stuff to keep my mind right. But sticking to what you guys are here for to see and watch, I just want to let you know that I believe in you. And sometimes you need somebody to believe in you and to help you and to guide you so you can get to that next level and level up and do what you need to do. And that's what this channel is here for. All jokes aside, I'm not coming for anybody else's channel, but I know what we do over here. And I truly believe in the people that I have handpicked to be a part of my team, because we winning over here, guys. You know, I can be over here all day long sharing it, and I wanted to keep this video short. So we just hit 20 minutes. So I'm gonna go ahead and seal it. But thanks so much for watching. As always, make sure you go in the comment section. If you didn't know one of these assessment tools, put it in there. Be like, Cage, Audit, PHQ9, GAD, you know, yell them out like they gangs and stuff. Just put them in the chat. I always say chat, put them in the comment section and just put one up there that you didn't know. And now you know. So I can know that this is helping you and you're getting to where you need to be. Thank you for sticking with your girl. I got more videos coming for you. Make sure you join the community. Make sure you just do something. Join the channel community, something. I just want to connect with you guys. And this is the best way I can do it. Be blessed until the next one. Take care.